Hello, good evening. You're all very, very welcome to our Postgraduate Virtual Opening Event. So this evening, myself and my colleagues, Professor Barry Maguire and Dr. Emily O'Dowd, will give you an overview of our academic programs and our education programs that we offer here in Surgical Affairs in the Royal College of Surgeons in Dublin. You're all very welcome. So my name is Dr. Marie Morris. I'm a senior lecturer here in Surgical Affairs in Postgraduate Surgical Education, and I'm the academic lead for the Masters, the MSc in Advanced Clinical Practice. Okay, so we'll start with our MSc, our Masters in Advanced Clinical Practice, which is a 2-year part-time program, and it starts in September 2025. So the program, as I say, has been carefully designed. We've looked at all the roles that you will play eventually as you move from sort of novices up to intermediate and then expert level as consultants, all the various roles that you'll have to play as part of that continuum and that journey of clinical practice, looking at your teaching skills and your leadership and your management and your ability to get quality improve. So it's been very carefully designed to take that into consideration so that the content is very clinically relevant to you. And it's information that when you learn the theory in the module, you can then immediately transfer that into your clinical post. So that helps the learning to stick. So it's a level 9. So a level 9 as part of the Irish National Framework of Qualifications is a master's level. So provided you have your undergraduate medical degree, you can study at master's level. It consists of 3 core modules: research methods, which is obviously essential. So if you have no research experience, that's absolutely fine. This program will teach you that. Research ethics and law, which is obviously a core component of your clinical practice, and a research project or a research dissertation. So you have choices here, again, to do what best suits you and your career progression. So you can do primary research along with a clinical supervisor that you work with, a sidearm of, say, a consultant's project. You can do a systematic review of the literature on an area you're interested in and aim to publish that with your supervisor. You can plan a comprehensive research protocol for a future project. You can do a meta-analysis of data and RCTs. So there's lots of opportunity to, mold this master's to best suit you. And the program is open to all physicians. Any area of medical practice that you're working in, you'd be eligible to undertake this program. So the goal of a master's level program, and specifically this program, as I mentioned, was to move you along the continuum towards expert practice and independent practice as a consultant. And so really what we look at is designing and delivering modules that help you develop sort of higher order skills, that you're moving to be more critically analytical, that you're sort of constructing and creating new knowledge, and that you're stepping into the various roles of leader and manager and quality assurer and educator, and that you're getting the theory to underpin these roles and then the practice clinically early in your career so that you refine them as you move towards later training and practice. So one of our very popular modules is leading and managing your organization and services. So again, as I mentioned, these are core skills that you may have innately, but you can certainly, all of us can always improve on some of these skills. So all the modules are designed to fit in with your clinical posts. So generally it would be 1 day a week that you'd be required to attend some element of teaching and or assessment. We really carefully space and plan your teaching of your modules and your assessments, and we map them across the year to ensure that we manage the workload so that it's doable alongside your clinical post. We always liaise with subject matter experts, either nationally or internationally, to deliver the modules so that they're really clinically relevant, they're evidence-based, and they're up to date with experts in the field. So you will get exposure to subject matter experts and evidence-based, up-to-date evidence-based knowledge that you can then use and transfer into your clinical skills. So the value really, you're going to obviously be competent clinicians. Many of you will do membership exams, so you'll professionally develop, within your subspecialty of medicine. Some of you will do some research and build up your research profiles. If you have no research, like I said, this is a perfect program to do an introductory research methods and, you know, your first research project. That's absolutely fine. We can support you with that. But alongside that, your personal development, undertaking an academic program supports your professional and your personal development. It moves you along that continuum, like I said, to be more intermediate towards expert practice. It pushes you to develop as a person that will help you make better clinical decisions, because you'll have those higher order skills. You'll be better able to differentiate between information and knowledge. And like I said, it really does prepare you for the domains of practice that will be required the further along your career you go. You know, that you do need to hone your skills as a manager and a leader and an educator and an innovator. These are all parts of the post and the role that you play in clinical practice. And obviously, if you develop personally, professionally and academically, you're going to deliver a better service to your patient, a safer service and a knowledge and evidence-based service. So it's a very enjoyable program. And I look forward to seeing some of you on it soon, I hope. So what we're going to look at next is our Clinicians as Educators, which is an effective teaching skills. It's a micro-credential. So micro-credentials are a relatively new concept in higher education. They're like a bite-size program that you can do. So if you haven't studied for a while and you're a little bit rusty, or you're concerned about studying at master's level and you feel it might be a large jump for you academically, micro-credentials are a really nice stepping stone. So they're a standalone module where you choose a module. This one is 10 ECTs, so it's 10 credits. It's at master's level. And the idea would be that you, over time, could stack these modules. So you take a small bite-sized module and you might do 2 more modules at 10 credits that are related to education. And then you can apply for a major award of a postgrad certificate. Or you can do 6 by 10 credit modules. And again, there needs to be a related topic so that you're getting a body of knowledge and evidence in one topic, and to have a postgrad diploma. So these are nice ways of professionally developing. If you already have a master's and you think you don't need another master's, but you haven't learned effective teaching skills formally, this would be a really nice teaching course to do, to give you that professional qualification, and not be too onerous as an academic undertaking. So our next intake for this module is in March this year. And it is in essence a teach the teacher course. We're going to teach you how to teach. I've carefully designed this to be very clinically relevant. I'm really mindful. Obviously, I spent 20 years in clinical practice. I know the challenges of trying to teach as well as deliver a service. So it's very practically minded. I've very much designed it that it can be done on the fly, that you have you learn how to plan sessions, and such that if a teaching session is sprung on you, say at the end of a ward round, that you're ready to go. You have a lesson plan on your phone, and you can deliver quality education. You can assess based on best evidence. So it's very practical. Like I said to you, it's 10 credits. It's a level 9, so it can stack towards a master's program. I've done it over about 5 weeks. It's 1 day a week maximum that you would be expected to attend. And the requirement is you generally have to have a medical degree, a level 8 medical degree. So the program is only for physicians and surgeons. Okay, so how I approach developing this particular program, because it's skills based, there's lots and lots of practice of teaching, feedback, practice assessing feedback. Do a buddy system where you can work with your peers and give them feedback and observe them. We have discussion boards so that you can post discussion titles and foci each week, and you can discuss and get your peers' feedback and opinions on various aspects related to teaching. So it's very interactive, it's very student-centered, it's very active. You need to get involved and do, and as you know, for skills are doing rather than talking about, so it's important that you actually do. So it's very proactive approaches that we use. So, you know, the idea is that, like I said to you, the end of the program, we want you to be able to actually plan a lesson well. Have that, like I said, on your phone ready to go for small or large groups, so that, you know, that you're always ready to teach and teach well. You'll definitely improve your presentation skills, because you'll be doing presentations, you'll get feedback off your peers, you'll observe your own peers doing presentations and see how they approach, and obviously you'll get faculty feedback as well to help you progress your skills. And we'll also look at how you can plan an assessment. Many of you might assess in OSCEs and various things with or without any training, so we'll give you, you know, the knowledge base to underpin how assessments run and should run. And then obviously look at ways of evaluating yourself as a teacher, so that you're constantly improving and developing your own professional identity as a teacher. And Daniel here did the course with us last year, and, you know, he really enjoyed the program, and it's fantastic. I mean, the best outcome from a teacher's perspective, or an educator, as I am and you are, is to see that he has found that it actually helped him to mentor others in clinical settings. And that's always the goal with any of these educational programs and academic programs that we teach you, is that we want you to transfer that into the clinical job, so that it's contextually relevant for you. It's not a standalone knowledge-based program that doesn't relate to your clinical practice. It always has to translate across to your clinical practice to improve you, to improve any students that you're going to mentor or supervise, and obviously making you all better is going to impact positively on the patient. So it was great to have Daniel and all his class last year. So, you know, the learning side of it, like I said, we're, you know, it's about lesson plannings and presentation skills, practical tips as well on, you know, managing students' behaviors. If you have students that are challenging in the classroom, how do you manage these situations? So it's a very practical course. It's very much, like I said, based on the clinical bedside teaching. Big part of it is learning from your peers, because you're all excellent, so you learn from each other. It's just honing those skills and getting some feedback. Also, we have a full day of where you can practice feedback and have feedback on your feedback. So it keeps that whole cycle continuum. We teach you how to write a teaching philosophy statement, and also the assignment actually sets out a structure of a teaching portfolio. So from your career perspective, you will obviously be clinically competent and assessed over time. Many of you will do professional examinations. You'll start your research. Your research outputs will be, you know, searchable on Scopus, and people will be able to see what your research outputs are like. But often by the time you get to consultant level, the missing piece is the teaching, evidence of teaching. You're unlikely to have kept a record of every day you ever teach. So the idea with this course is to get you thinking about that earlier in your career. Start your portfolio, start reflecting on a couple of teaching sessions a year, getting some feedback and keeping that. It can be an electronic profile, it doesn't have to be paper, so that by the time you get to senior level and you're looking towards independent practice as a consultant, that you will have that data ready. So that's the idea of the, you know, the practicality of the assignment is to prepare you for the future. So you'll see there from the dates that we've sort of spread it out so that you know, it doesn't run over a hugely long duration, but there's gaps. It's spaced learning, so that you have time to go away and think about what you've covered on day one and assimilate that and maybe practice some of that clinically, see how it went, come back to us on day two. We'll debrief and look and see what worked, what didn't, hone the skills even further, and then move into feedback. And then we have micro-teaching assessments. They're always fantastic days where yourself and your peers will present and get feedback. And it's really interesting. We've often had students that have picked the same topic unknowingly, but to see how they approach it and present it from two completely different angles is fantastic. There's such great learning from that. You only need to attend one of those days, the 22nd or the 23rd. You don't need to attend both. That said, last year, the students that presented on the first day, the majority of them asked to come back on the second day because they wanted to watch the rest of the presentations because they enjoyed them so much. So you are, of course, very welcome to attend all of the programme. So that's a summary of our Clinicians as Educators Micro-Credential. So I really do hope to see some of you starting with me in March this year. So thank you very much for listening. And I'll pass you over now to my colleague Emily, who will run through the human factors programs with you all. Many thanks.
Thank you very much, Marie. Hi, everyone. My name is Emily O'Dowd, and I am going to be speaking to you about the online postgraduate diploma and MSc in human factors and patient safety. So, as I said, my name is Dr. Emily O'Dowd. I am one of the senior lecturers on the Human Factors and Patient Safety programme and the academic lead for this programme. So my background is in psychology, and I approach the programme with that perspective and bringing that human factors experience and applying it to healthcare. Great. So the learning outcomes for this programme, we have a few here just up on the slide, but mainly they are to advance the practical skills to drive safety and quality improvement in acute hospital setting. So we really want our learners and scholars to come away from the programme with the actual practical skills to apply to their workplaces and drive that safety and quality improvement that's so vital to our healthcare system back in their workplaces. We also want to develop scholars' interpersonal and non-technical skills to support safe and effective patient care. So this is your communication and leadership skills that all contribute and are so vital to safe and effective patient care. Thirdly, we want to develop participants' skills to conduct high-quality patient safety research in healthcare. So this is something I'm very passionate about, and throughout the programme you do get an opportunity to build on your research skills or develop research skills if it's something you've experienced in or not experienced in before. We do try to build up your confidence and skills in conducting high-quality patient safety research within a healthcare setting. And finally, and I suppose underlying all of it, we want to develop your knowledge of error, risk and safety in healthcare. So the theories underpinning error and risk and safety, the human factors contributing to safety in healthcare, and I suppose give you that grounding and foundational knowledge in all of these theories that you can then start to apply to your work in healthcare. So a bit of background, I suppose, on the course structure and some key information about the programme. So the programme is set at a level 9 on the National Frameworks for Qualification. It is a totally online and flexible programme, so it is part-time and it's fully online since about 2020. The postgraduate diploma is made up of 5 modules, which is 60 credits. And then if you do choose to go on to complete the MSc, you have an additional 30 credits made up of a research dissertation, which takes place in year 2. So the programme can be undertaken, as I said, as a certificate, diploma or master's. The certificate is an exit award after the first 2 modules. However, most of our scholars will tend to go on to complete at least the postgraduate diploma, if not the MSc. We've actually had a big increase in people continuing to the full master's programme lately. So it's 100% online and part-time, and there is approximately 1 interactive day each month. This will depend based on the modules. Some are shorter than others, but you'll have about 2 to 3 per module of an online interactive day, and it works out at about once per month. The rest of the programme then includes, I suppose, didactic teaching and then self-directed learning as well. So discussion boards where you're interacting with the other scholars on the programme. Reading, independent reading. We offer a lot of videos and resources online through our virtual learning environment, Moodle. And it's kind of structured in such a way that it's appropriate for people who are working full-time and working in healthcare, that you can do a lot of this on your own, in your own time. I suppose as well, we're also very conscious of people's work shifts, and when we do offer those online interactive days, we do record them as well, because we're conscious it's not always possible to get a certain day off while you are working full time as well. So here's a little bit more detail about our modules. We have 5 modules in year 1 and then a 6th module, which is the research dissertation in year 2 for the MSc program. So you can see just a few details about them. We start off with module 1, which is error and safety in acute healthcare. And this is where we really, I suppose, go in depth into the theories of human factors and patient safety. What is a systems perspective on patient safety? How can we learn about error and risk and start to learn how to then improve these and make healthcare safer for patients and for staff? Then we go into our personal effectiveness and non-technical skills model. So we touch on leadership styles, the factors that contribute to improving your own personal effectiveness as a healthcare leader, and then also team performance in healthcare as well. So a lot of communication skills, non-technical skills, and that aspect of human factors and patient safety. Next up, we go to leadership, process and quality improvement. So again, taking a look at the theoretical principles underpinning quality and safety improvement in healthcare and how you can start to or develop on your skills that you already have, how you can lead this change within healthcare. Our 4th module is professionalism and advanced communication. So again, we explore communication skills, including relationships with patients and also with colleagues as well. And then we kind of introduce the concepts and practice of advanced communication, such as shared decision making, open disclosure, end-of-life care, all of which are very topical and relevant in healthcare at the moment. And consistently, I suppose, the guidelines and laws around the world are changing on these quite frequently, so it's kept up to date, and we have experts to speak on these topics as well, which is really helpful. Then our 5th module and final module for the postgraduate diploma is research methods. So as one of the learning outcomes was to kind of build your skills and develop your skills in research in human factors and patient safety, the research methods module is actually very core to that. So if you have no experience with research, or if you have, quite a lot of experience with research, it's still going to be very applicable. It's going to enable you to critically analyze research papers in the field, how you can assess evidence, start to understand the methods that are used in this field in human factors and patient safety for research. And then if you do choose to go on to year 2, it provides a really solid foundation for your own research. So that's module 6 is your advanced research methods and dissertation, and that is, I suppose, your kind of independent research project that you will complete as part of your MSc project. So for the dissertation, scholars are supervised by an expert in the field, whether that's to do with the methodology or the topic, and they are encouraged to complete their own program of research. And a lot of scholars have gone on to publish this research, or indeed brought in their projects into their workplaces and applied them to their workplaces as well. So a really useful and practical, I suppose, aspect to the MSc program. Okay, so as I mentioned earlier, our program is 100% online, and this, I suppose, with the online teaching, we use a number of different methods to ensure that it's engaging and that you still feel connected to the rest of your group. So that's consistently the feedback that we get on the program, is that scholars still feel connected to their classmates, which is really important when you're doing, a program of study, and we really encourage this. So our weekly discussion boards are a great place to interact with your peers and classmates, and also the group projects. So we're really conscious when setting the group projects and assigning groups, we make sure that it's an interprofessional group of scholars, and we do change them every module as well, so that you get to work closely with as large a group as possible across the modules in year 1. As mentioned earlier, we have our online interactive days. So these are live sessions with experts where they will deliver a lecture. There'll be group work within the online day, and these are typically for I suppose, a full working day. So about 9:30 in the morning Irish time to 4:30 in the afternoon, again Irish time. And as I said earlier, these are fully recorded. So if, you know, someone gets called into work, it's absolutely no problem. We can work around that and they can watch recordings back. We do recommend that you come to them in person, or we do recommend that you come to them while they are live, because you get the opportunity to interact with the experts. However, we understand that that's not always possible. We also have online content. So this is your kind of self-directed learning. So we have key seminal papers, optional readings, videos, and kind of other resources to explore in your own time as well. And finally then, for the majority of the modules in year one, you'll also have a written assignment. So this is a piece of individual work. It's a piece of writing. So we do expect a high standard of academic writing, but we support scholars who are maybe not used to this type of writing, have maybe not done it in a while, and we have a lot of resources online to support this as well. Okay, so who can apply to the program? The eligibility criteria of the program are here on the screen. So the program is suitable for those working in an acute hospital setting, including surgeons, physicians, anesthesiologists, emergency medicine doctors, obstetricians, pharmacists, nurses and midwives working in healthcare, as well as safety and quality managers. Now, we say here working in an acute hospital. However, we have had scholars in the past who are working in different sectors within healthcare. So, for example, in pre-hospital care, people who have previously worked in hospital settings but are now working in the community in maybe a risk or safety and quality role. So if you're uncertain about the eligibility or whether you are eligible for the program, please do get in touch with us and we'll kind of look at this on a case-by-case basis to make sure that the content is relevant for you and that it will actually contribute to your work going forward. So we're very lucky in the postgraduate diploma in human factors and patient safety that we have quite a large international footprint, I suppose, really facilitated by going online as a program. We have, over the past number of years, had scholars from over 20 countries outside of Ireland, which is really fantastic. These include Australia, the United Arab Emirates, Sweden, UK, Germany. It gives us this different perspective into healthcare and quality and patient safety in healthcare. I suppose, you know, we're working within one system, but it's great to share those insights across systems and learn from other healthcare systems, you know, how things can be improved, how we can make patient care safer, and what are maybe some of the different factors and barriers to safe care across the world. So, yeah, we have more than 200 alumni who are improving human factors and patient safety worldwide. And we're really lucky as well in that we have a human factors academy. So all of our alumni are automatically enrolled in the academy. And through this, we're building, I suppose, a network of human factors connections and people who you could potentially collaborate with in the future. So trying to build that community of knowledge and share our learning across the globe as well. So speaking of alumni, you can see a number of our alumni here on screen. So what are alumni doing now? I guess primarily they're making a difference and we're really proud of the work that they're doing. As you can see there, an understanding of the theory around patient safety, errors and the individual and system level factors is vital for healthcare leaders. Alumni of the programme have published their research, brought their learning back to their workplaces and even used the programme to progress within their own area of work. We, you know, very often have scholars who are currently on the programme or alumni of the programme who mentioned that they have been promoted within work thanks to completing this programme of study. You can see Sue Markey up at the top up here. She has presented her research for that she completed as part of her MSc at a number of different national conferences so far. So the Irish Human Factors and Ergonomics Society Conference and the 4th National Human Factors and Patient Safety Conference held in RCSI. And she's just been accepted to present at HEPS 2025. So this is a European level conference being held this year in Dublin. And she is working on publishing not 1 but 3 papers out of her MSc research. So, you know, there's so much that can be done. She's also moved roles within her own work and is bringing that learning back to her hospital and her hospital group. So really, you know, amazing the amount of work that these people are doing. Our scholars are typically leaders in healthcare already, and then are going on and bringing this knowledge back to those roles and sharing it amongst their hospitals. So with that in mind, I suppose we have a video which is the story of one of our alumni, Yvonne Young, which we're now going to show to you. Thank you all so much.
Hello, my name is Yvonne Young and I'm a nurse. I'm a Group Assistant Director of Nursing with the UL Hospitals Group, and I am also a member of the National Sepsis Team, and I am a member of the Advanced Nursing Platform with the Global Sepsis Alliance. I undertook the MSc in Human Factors to enhance my knowledge and expertise in the area of patient safety, and I want to do everything I can possibly do to make a difference in my area of work and to enhance patient safety and facilitate staff being able to come to work and being able to do their work safely. I have a special interest around the escalation of the deteriorating patient and the facilitators and barriers to early and appropriate escalation. The MSc has given me a completely different lens to how I look and approach things, how I do patient case reviews, how I undertake QI projects, how I do audits, and also around the development of clinical support tools. You cannot have a true understanding of patient safety without having a true understanding of human factors. Undertaking an MSc in Human Factors has given me a greater appreciation and understanding of many things such as systems, the power and importance of culture, human behaviours and how human beings interact with each other, psychological safety, situation awareness, the impact of civility and incivility, stress, burnout, teamwork and much, much more. I feel the MSc has increased my own self-awareness, and it has given me access to a like-minded community and to experts in patient safety from around the world. And that connection has been invaluable to me. Engaging with like-minded colleagues, it energises me and drives me to continue to do what I can do to improve healthcare. The virtual aspect of the course makes it much more accessible and user-friendly, and the course facilitators, I must say, are extremely supportive and very mindful that the majority of participants are working full-time and busy and demanding jobs in healthcare. We cannot eliminate risk, error and human fallibility in healthcare, but we can optimise best practice and constantly review how we can moderate or reduce risk. But we can't do that without including the science and expertise of human factors so we can optimise patient outcomes. I do feel that the MSc in Human Factors Patient Safety has been invaluable to me on both a personal and professional level.
Hello everybody, and welcome to this online introduction to the RCSI Continuous Professional Development Support Scheme courses. Thank you, Emily, for the seamless introduction, and it's a pleasure to connect with all of you today. These self-paced courses are designed to be 100% online, and it tailors to fit the busy schedules of healthcare professionals. For those of you who don't know me, my name is Barry McGuire. I'm the Professor of Postgraduate Surgical Education and the academic lead for this programme. I'm a consultant urologist and a robotic surgeon based at St. Vincent's University Hospital in Dublin. There are over 10 self-paced courses available which cover a wide range of practical and relevant topics for healthcare providers. These courses are designed to give you the skills and knowledge to excel in your field, all while being flexible and easy to fit into your schedule. You'll see from the slide here these courses outlined with a QR code for more information. Our self-paced courses are perfect for doctors and healthcare providers working across various health services. Each course includes recorded modules you can watch at your convenience, CPD points awarded for every module you complete, written summaries and key learnings for easy reference, and real-world case studies. Optional discussion groups and interactive content to deepen your learning experience are also available. Our courses are built with the busy schedule in mind. Choose the course that interests you and learn from leading experts within the field. Complete the course at a pace that works for you, and then you can download your certificate of completion and showcase your achievements at the end. I'd like to put a little spotlight on the foundations of robotic surgery. It's a standout course for us here. This program features 9 learning modules that cover the fundamentals of operating a robotic system on multiple platforms, achieving robotic surgical competency, and the course is open to surgical trainees, doctors, nurses, and anybody working within the robotic surgery field, which gives a nice introduction to the various aspects of robotic surgery. It was created by surgeons for surgeons with content delivered by experts in simulation, high-fidelity synthetic modules, and robotic surgery. Another key course is Safe Clinical Handovers, which focuses on one of the most critical aspects of healthcare communication. You'll learn about the value of effective communication in maintaining patient safety and common challenges in clinical handovers, strategies to improve processes for managing transitions of care, and through learning videos and real-world scenarios, the course equips you to practical skills to enhance handover practice. I'd like to thank you all for taking the time to learn about these self-paced courses. They're an exciting opportunity to expand your skills, earn CPD points, and stay ahead in your field. Now I'd like to hand you over to my colleague Marie, who will share more about how you can get started and the resource available to support your learning journey. Over to you, Marie.
Thank you, Barry. So to finish off, we're going to look at our final and most long-standing master's program in the department, our Masters of Surgery by module. So this master's has ran for well over a decade. It was designed and ran for many a year by Professor John O'Byrne, and he handed it over to myself and Professor Barry Maguire a couple of years ago. So this program can be offered full-time or part-time. You can do it part-time alongside your clinical post. It would work alongside your surgical training if you're in CST 1 or 2, or if you're in ST 3 or 4. You could do your master's alongside your clinical post, or if you have a year out or you're doing research or teaching, you might decide to do the program full-time. So you have those 2 options to see which best fits your lifestyle and available time. And our next intake is in September this year. So this program has been designed very much to support your clinical role, and if you're doing surgical training as well, so that you can develop your surgical technical skills and your human factors, which would be part of your surgical training if you are on a formal training program. Or if you have an interest in surgery and you want to have the academic knowledge to support the training aspect, you could undertake this program. So it's available to a wide group. And again, it's to support you in the skill set academically and clinically that wouldn't be sort of traditionally taught alongside the sort of technical skills. So, you know, our goal is to support you to develop as researchers, to develop as educators, managers, leaders, innovators, and all those various roles that you will undertake as you progress through your surgical career. So it's a level 9. So level 9 is a master's level. It consists of 90 credits and 90 ECTs, which is part of the Bologna process of masters across Europe. You have core modules which are based on research methods, so that you learn, if you haven't previously taken research or undertaken research. Equally, if you're an experienced researcher, you can hone your skills and learn more through these modules. We cover healthcare ethics and law, and you have a research dissertation, which again, this research dissertation, it can be primary research. So if you're working with a team who are already doing research, you can do a sidearm of that as your project. You can do a systematic review of the literature and aim to publish with your supervisor. Again, you can do a meta-analysis of data. You can do a research protocol. So, you know, we work with you to make sure that what you do is very clinically relevant and is going to feed into your post and into your progression and into your CV. So what we've done with this program is to ensure that the knowledge component is delivered online. We're mindful that you, obviously, many of you are across the country, and with, travel is a challenge, and or leaving clinical practice for a full day can be a challenge. So the program has been redesigned to be predominantly online. It's about 80% online. So if it's knowledge-based, it's online. And if it's a skills-based module, then it's face-to-face on campus. So that's, that you're only coming on campus when it's really required to attain skill set. Eligibility, we would suggest that you at least have an intern year or done foundation year 1, maybe foundation year 2, so that you have some clinical context, so that when you're covering the content of the modules, they have clinical relevance, that you can go back after your module and observe the content of that module in clinical practice, and that way you can sort of marry the two, which then leads into the learning sticks and becomes more long-term skills acquisition and knowledge acquisition. So we would suggest that you have some clinical experience behind you. That said, if you're newly qualified and you've an interest in surgery and you don't have a clinical post, you can still come on the program. But a bit of clinical experience will certainly help you. It also will help if you're in a clinical post to identify a research supervisor that's an expert in the field that you want to study as part of your research component. So that will also help you. So, you can reach out and ask us any information that you want with regards to when you take this program across your career. So the module, there's multiple modules that you can choose from in surgically related and then more generic modules. So global surgery is another example of a fantastic module ran and delivered by international and more global experts in global surgery. It's a really, really innovative module, and also, gives you some context of the challenges faced in, middle and lower income countries, and the challenges faced trying to practice safe surgery with very little resources. So it's a very, very good module. It puts things into perspective, and like I said, you'll have exposure to global experts in the field of surgery overseas and humanitarian issues and crises across the world. So again, as with all the modules, they're carefully planned. They're mapped across the whole year if you're full-time, or 2 years part-time. The teaching is mapped and spaced so that it's doable alongside a job. The assessments are mapped and spaced so that you don't suddenly have 5 assessments due on the same week. So we're very mindful that most of you will do this program alongside a clinical post. And so to ensure that you can do both and manage it, all of the modules are carefully designed so that you have a manageable workload. So yeah, the value. So the value, as we mentioned earlier, your clinical competence, your technical skills, your human factors and non-technical skills will all be part of your surgical training program, wherever in the world you do your surgical training program. So the benefit of studying an academic program at level 9, at master's level, is to underpin the knowledge base and then the skills of the other roles that you will be required to undertake as you progress from intermediate level of competence through to independent practice as a consultant. So it's very much about preparing you and teaching you the theory that underpins leadership and management, being a clinical educator, being an innovator, understanding quality assurance and clinical governance, and learning how to work, as a surgeon in a clinical setting, locally, nationally and internationally. So that's, you underpin the skills with evidence-based knowledge, and also develop your higher order skills, teaching you at master's level. All of the modules and all the assignments help support you to move along the continuum to more critical analysis better clinical decision making, starting to construct and create new knowledge, and so that you're adding to the body of research in the field that you choose to practice. So you will grow professionally and personally along that continuum if you support your training with an academic program. We have some fantastic alumni of the program over the years. People have gone forwards to be leaders and champions internationally in the field of surgery, fantastic academics and researchers, and you know, it's fantastic that we have, you know, over a decade of alumni, and they keep in touch, and many will return and you will meet as part of this master's that now teach on the program. So it's a fantastic full circle when somebody can come through undergraduate medicine, right through the surgical training and master's program, and then come back in as an educator of the next generation. So it's a lovely full circle, and there's always opportunities available to you on the completion of your master's to come back and contribute to the formal education of the next generation of doctors. So if you would like some more information, you can email us. So any of the programs that you've heard about tonight, if you've got any queries or you think I'm really interested in that, if you could email us on postgrad essay for surgical affairs, so postgradessay@rcsi.ie, and we'll very happily answer any queries that you have. If you want more formal information and updates on a regular basis on the progression of any of these programs and any information about further events or open dates and various things, then please scan on the QR code there, and then you'll come along that journey with us towards the start of these programs. So thank you on behalf of my colleagues this evening, thank you very much for your time and your interest, and we really do hope to see some of you on one of our programs starting in September. Many thanks. Good evening.